So I wanted to do an education on providing customer service and managing challenging behaviors. So those things oftentimes go hand in hand, and although we're going to touch on providing customer service and creating a positive experience for more than just residents, the bulk of this video is going to be talking about providing customer service to residents and dealing with challenging behaviors coming from residents. So let's go through the information. I hope to keep this about 15 minutes or less. So defining customer service, and like I said, although we're going to speak primarily about managing resident behaviors and providing good customer service to our residents, we do have an obligation to a lot of different people, not just residents, but to their families, to their friends, to their visitors, to each other and our fellow employees, to our doctors and nurse practitioners and dentists and podiatrists and vendors and guys who are installing the air handling system and the construction crew who's building our new building. Basically, everyone that comes in here that interacts with us is our customer, and it's important that all of these people have a positive experience and have a positive time when they're coming into the Morrow home or when they're working with the Morrow home, because all of these people and everything that they do here is pretty vital to the overall care of the residents. I know that it's easy to get kind of short-sighted because we are really focused on what we can do for the residents primarily, and I'm guilty too. I feel like I'm a nurse, so I am providing one of the most important things for the residents. I'm providing clinical expertise and recommendations and assessments and medications and all of that stuff. And then the CNAs are providing basic, like the care that you need to stay alive. So obviously those things are super important. So I think that it's easy to forget that we don't cook all their meals, and we don't write their medication orders, and we don't install the air handling system for the home that they live in. We can't fix their thermostats. We can't make their supplies. We can't deliver the supplies that they need. So all of us create the environment that residents can thrive in. It's not one person or one department or one group or one job description. It is everybody, and everyone should be having a positive experience here, so they're prepared to do the best job that they can do for our residents. And also it's important to treat people with respect, because that's just an expectation that we have of employees that work at Morrow Home. We expect that you'll be kind to people. So there are obviously barriers to providing that positive customer service experience. And in healthcare, I think the number one thing, or maybe the number one and two things that we hear about, are burnout and staffing problems. And although those are real concerns and they plague us all the time, they're problems that we have to figure out solutions to and work consistently to keep those from overwhelming the care, but they aren't excuses. So providing a positive customer service experience, providing good care to the residents, making sure that each interaction that you have with someone is as good as it can be. Those things can be made much more harder if you're burnt out, if you're fatigued, if you're short-staffed, but they still have to happen. So other barriers you might run into are just personality conflicts with your residents or with your peers, behaviors from your residents, or surprises, getting a wrench thrown in your day. A family member shows up and they don't have an appointment. What do you do? Or a provider wants to do a telehealth round in 20 minutes because that's just the time they want to do it now. We're going to have wrenches thrown in our days, and that makes staying positive really challenging as well. But all of these things are things that are going to be somewhat prevalent in healthcare, and so being able to navigate them to the best of our ability, to be able to take care of ourselves and provide provide for self-care and provide a good environment for each other, that's going to be what drives our ability to continue to provide positive experiences for our residents. So like I said before, primarily we're going to be talking about residents' customer service and residents' behavioral concerns and how we interact with them. I just wanted to throw out there so that we all kind of have in the back of our minds that we're all customers, and our peers and vendors and all of the people that we work with, not just our residents, are deserving of kindness and empathy and respect. So residents' behaviors, we're going to see a lot of those. We deal with people who have dementia. We take care of people who have mental health concerns, who have lots of potential issues, strokes, neurological changes, and people who just have really stubborn personalities, might be resistive or non-compliant with some of their cares. So we're going to run into these things. It's just the reality of healthcare, and being able to deal with them to the best of our ability is going to help our residents have good experiences and good care. So obviously, just almost like any other issue that we have or problem that we have in healthcare, prevention is the best method of treatment. Preventing behaviors from even developing is probably one of the best things you can do for the residents and for yourselves to keep yourself safe. Maintaining consistent schedules and routines as much as possible, having good care plans, good documentation on the sleep-wake cycles, having good snacks, knowing activity preferences and having those well documented, engaging the residents at the right times, getting them up, helping them go to bed, making sure that they're kind of in the right place or the place that they like, and be mindful of your demeanor and tone. Before you have an interaction with someone, make sure that you don't sound like you'd rather be somewhere else. It's important that you're present in the moment that you're speaking to somebody. Be mindful of your demeanor and your tone, and if you're frustrated, if you're angry, if you're upset, you have to be able to put that out of your mind when you're working with your residents. They can read body language, they can read tone, they can see you roll in your eyes. So obviously none of that would be appropriate. So so just be mindful of those things. And then I am not going to read this list because I think that we all know that we should not nag, argue, scold, laugh at, etc. to our residents or to each other. And then when a behavior escalates, even if you have remained calm, even if you have reapproached, basically just understand the signs of what that might be, and try to keep yourself safe, try to keep the other residents safe. Keeping everyone safe is kind of the #1 priority. Most of the behaviors that we have here at the Morrow Home are going to be things that we can handle. They're going to be things that we can reapproach. They're going to be things that we can call a nurse over, that we can call a doctor in for, that we can prescribe a medication for, that we can prescribe a different kind of therapy for. So there's so many interventions that we can actually do that the actual need to send to the ER for behaviors or call the police because of behaviors, those don't exist very often here. So make sure that you do everything possible to keep a calm environment and to decrease stimuli and to keep the residents safe. And then escalate. If you really need my help, the administrator, the charge nurse, whoever it is that you can get that can help with escalating or potentially violent behaviors, that's what you want to do. So let's look at a couple of, not there yet, sorry. Make sure that you're checking the care plan, of course, yes. Looking at the interventions that are listed to help manage behaviors, and use your common sense too. A lot of you guys that are watching this have been in healthcare a long time. You've seen a lot of things, you've helped a lot of people, and you have ideas about what to do when behaviors or when residents display behaviors or when residents are having hard days. You've seen people get overstimulated. You know that you can turn the lights down, remove the resident, take them to a different situation, turn the noise down. If you think of something that can help, even if it's not on the care plan, check with the nurse or check with me. Give it a try. We want all that we can do to make sure that residents have a calm environment and one that's satisfying, and that meets their needs. So let's consider some scenarios. A resident who is confused and has dementia yells, screams, and swings at you when you try to provide cares. How do you handle this? And I'm sure a lot of you have dealt with this situation, and I'm sure a lot of you have used a lot of these interventions. So number one is be calm. Use a low, calm voice when you're explaining what you're going to do, when you're introducing yourself. And if a resident appears that he or she is going to be physically violent, keep yourself out of harm's reach. Use 2 staff members when possible. Or if you don't seem to be getting through to the resident, leave them in a safe position and exit the room. You can reapproach for cares later. Or you can reapproach with a different caregiver and try something different later. Get a nurse to help with the behaviors. Sometimes nurses have more formal training on dealing with difficult behaviors or assessing underlying conditions. Is there pain? Are there skin issues? Is there something neurologic? Is the resident hungry? Is the resident scared? Is there a trauma that we don't know about? So making sure that we've assessed all of those things, also important. Offer alternatives and suggestions. So one resident who actually lives here, who this does apply to, was getting very behavioral in the shower, but as it turns out, bed baths actually went a lot better. So the resident gets bed baths now, and that is an alternative method of care that helps keep everyone safe and keeps the environment calm. So things like that, we can do things like that. We don't have to be rigid in the care that we provide. Everything should be person-centered. And you can also, if available, try to call the family for assistance. If you need suggestions or guidance, especially if the resident's new, call the family and see if they can help. A resident who is alert and oriented appears to be having a very frustrating day. So you go into the room to help her get ready for supper, and she starts yelling at you and calling you names. And how do we handle situations like this? And I think to start, we really want to make sure that we maintain our empathy. So even though the resident is alert and oriented, we're taking care of very vulnerable people, and we don't know everything that they're going through. At the end of the day, we get to go home. They don't. We have full use of our limbs, our brains, our bodies. They don't. So be genuine and apologize. I'm sorry that you seem to be having a bad day. Is there something I can do to make it better? But also understand that although I want you to have empathy, although I want you to be genuine, and I want you to apologize, and I want you to try all of those things first, you don't have to be verbally abused by people. And you're allowed to say, calling me names hurts my feelings, and calling me names isn't appropriate. So give the resident some options. You don't have to tolerate abuse, so you can say, would you like me to come back later when you're calmer, or would you like me to get a different caregiver for you? Those things are appropriate as long as you're doing it from a place where you've already tried to address the concerns with empathy and assistance. Report concerns and behavioral concerns to the nurse practitioner or physician, because sometimes behaviors like that can be related to depression or anxiety or other mental health issues, dementia that might be undiagnosed or that's advancing. And then remember just to have empathy. You don't deserve to be treated badly, but you are providing care to really vulnerable people. And you're gonna provide better care if you have empathy for those people. If you try to imagine the difficult and challenging situation that they're in, as opposed to becoming angry and frustrated with them. And this one's also a situation you guys might be really familiar with. So let's say you have a census of 65 residents, and you should be staffed with 8 CNAs, but there was a call-in, and now you have 7. Does sound familiar. You and your peers are now splitting up the work and trying to make sure everyone gets the care they need. And you know a resident has had the call-in on for a while, but you've been really busy, and it takes a while to get to it. And when you're finally able to answer the call-in, the resident's angry and asks you what took so long. So how do you handle this situation? And what I would always start with is that even though it's absolutely not your fault, it is not your fault you're short-staffed, unless you decided to go smoke for 7 minutes before answering the call lights, or you decided to go screw around and talk to someone on a different floor or something. It's not your fault that it took you that long to answer the call light. You had call-ins, you are challenged, but the resident doesn't need to hear that. So apologize, I'm sorry, but I'm here now. I imagine that it's frustrating to wait, and we're doing the best that we can. We're here to help you. I'm sorry it took so long, but please continue to use your call light. And I know that I've explained this to a lot of people already, so I'm going to explain it to everyone again. I'm going to ask that you don't ever tell the residents that you're short-staffed or that someone called in today. And I know that that's really challenging, especially if a resident seems upset with you because you took a long time to answer a call light. But typically, well, there's several things that happen with residents when you tell them that you're short-staffed. And the first scenario often is that the residents care very much about you. You are their family. You're the one who takes care of them. They know you really well. And they feel bad for you. So if you tell them that you're short-staffed and that you have a call-in, they're not going to put their call light on so that you'll help them again. They're going to try to take themselves to the bathroom and fall. Hopefully not fall, but more likely if you say something like that to them. The other option, or the other scenario that sometimes happens when we say things like that, is that the resident then gets worried and anxious. Well, if you had call-ins, or if you're short-staffed, who's going to take care of me? What if I need something and no one comes and no one's there? And what if I put my call light on and no one can come? And so then you're going to see residents who sometimes we've created that anxiety in them now, and they're going to need reassurance that people are going to be there if they need help, and people are going to be there if they put their call lights on. So you're going to see people put their call light on so that you can move their remote from one side of their tray table to the other, or pull a tissue out of their tissue box, or you know the things that I'm talking about, little things like that. And so I know that it's not your fault that you're short-staffed, and I know that it's not your fault that you had a call-in today, and I know that nobody wants to take blame that's been misappropriated to them, but making sure that you handle situations like this with positivity. I'm so sorry. What can I do now? I'm here now. That's going to be your best bet for providing a positive experience. It's not going to make your job harder for that shifter in the long run. And then I thought we could try a couple suggestions, because instead of saying to a resident or to a family member, I'm busy now, you'll have to wait, try, I will be back as soon as I can. Because I don't want to hear this first one. I'm busy now, you'll have to wait. That's dismissive, and it really doesn't show that you have any kind of interest in what they're telling you that they need. And you might not, but we're never going to act like that's the case. I'll be back as soon as I can. Never, please, say, you're not the only person here that needs care. It's unacceptable. Of course they're not. Most of the time people know they're not the only person there. But that's not helpful in any scenario. I'm sorry it took me a while to get here, but your care is important to me. Try something like that instead. You don't have to answer concerns or negativity with concerns and negativity. It's not your responsibility to do that. It's your responsibility to stay as positive as you can. And I know it's hard. Here's another one that I sometimes hear. We can't do anything about that. Social services isn't here till Monday, so call back then. And that might be true, but try. I'm not usually the one who handles this. Is there something I can do between now and Monday that would help? When you can talk to social services or rec therapy, or can I give you a voicemail, or what are you trying to accomplish, and then try to figure out and use what you know to accommodate that person. Do not roll your eyes. Instead of rolling your eyes, just don't roll your eyes. Instead of doing the big sigh, don't do the big sigh. Don't vent frustrations about coworkers to residents. Don't complain about coworkers to residents, and certainly don't complain about residents to other residents. So I know that this is pretty simplistic. I know the scenarios that I gave you and the interventions that I suggested and that we talked about, they're not going to work in every situation. I'm so aware of that. That's why everyone's care really needs to be unique, person-centered. Behavior interventions need to be unique and person-centered. And the doctors should really be involved, and the nurse practitioners should really be involved if the behaviors are challenging and interfering with their lives or their care, their therapies, or any of that stuff. So, so if you have any questions, please feel free to ask me, to email me. You can set up a meeting with me. You can ask me to come upstairs and try to help you, or to the first floor and try to help you with behaviors that you're having. I do want to be a resource to you. I know that it's really easy to get frustrated, especially when you're dealing and you're coming up with challenging behaviors. But that's what we do. That's one of our jobs. And when we're working with sick people, when we're working with vulnerable people, we're going to come across these situations. It's our job as the caregivers to provide good experiences with empathy, and to do the best we can to make sure that the residents' needs are met. And I know y'all do your best with that every day. So thank you very much for watching. And I'm sorry I went a few minutes over, but I appreciate you sticking around.